Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. I'm continuing today with the FAQ video series, and today I'm up to number 36. What's the difference between exosomes versus PRP? PRP stands for platelet-rich plasma therapy, and that starts with a blood draw from you. It's an autologous treatment where the blood is taken from you, usually from one of your arms, just as if you were at the lab. The amount taken depends on what's being done. So it might be 10 cc's, it might be 30, it might be 60, and then through a spinning process, the PRP is created, the red blood cells are actually gotten rid of, all right? So PRP has in it billions of platelets, lots of growth factors, about 10 different types of growth factors. It has various hormones and electrolytes, a lot of beneficial ingredients to help repair and regenerate tissues that are damaged, okay? All in all, there's about 30 bioactive proteins. Now, let's compare that to exosomes. So exosomes are produced by cells. They are byproducts of cells, and they're produced throughout our bodies. You could find exosomes in lung fluid, urine, saliva, blood, all over the place. Now, the exosomes that we use are derived from umbilical cord stem cells. So in essence, when you get an exosome treatment, it is an allogenic, a donor product, all right? So that's the first difference. PRP comes from yourself, exosomes come from a donor. Now, there's a big difference between the ingredients from PRP between the umbilical cord stem cell derived exosomes. As I mentioned, PRP has growth factors, hormones, platelets, as well as some electrolytes. Now, exosomes are different. They do have a lot of growth factors. That is a similarity from PRP, right? They have a lot of cytokines. That's a similarity as well. There are some nucleic acids. That's a little bit of a similarity. And there's various amino acids and a lot additional proteins that PRP just doesn't have. Another similarity is that neither really involves cells. There might be a few stem cells in PRP. There are none in exosomes. They're actually a cellular byproduct. Now, one thing that PRP is actually pretty good at is acting as a scaffold for new tissue regeneration. In addition to that, PRP creates an inflammatory response, which you may know is the first phase of healing. So there are a lot of providers internationally and even in the United States that use them together. A lot of times it's for aesthetic procedures or other things, because the PRP is going to act as a structural scaffold and help jumpstart the healing process by starting up inflammation and the healing cycle. And then the exosomes are very, very good at facilitating new tissue repair and regeneration. Actually, with aesthetics, they're very good at promoting collagen formation, as well as wound healing. Another function that they both participate in is angiogenesis with new blood flow. Okay, so that gives you some of the differences and similarities between exosomes and PRP. Visit us online today at r3stemcell.com. Call us to get your free consultation set up at +1 844 GET STEM to see if you or a loved one is a candidate for one of these revolutionary regenerative procedures at any one of R3's 70 centers in 7 countries. Thanks for watching.